So, hello and welcome, Rajiv. Before we start, we often hear from the other Bajekals. So, that's your talented daughter and your wife who have been on our podcast already, and they're really active in this plant based health education space. But you seem to be keeping out of the spotlight. So, we would love to hear your journey to becoming a plant based doctor.
Thank you, Claire. I think I'm a little embarrassed by my journey, so I've kept a lower profile than my wife and daughter because they went plant-based and vegan really for ethical reasons, but then subsequently saw the health benefits. And I was seeing it in them for over 15 years before I decided to turn vegan about 8 years ago now. So I joined the party much later, and primarily it was just because I saw myself as quite a socially active in the sense socially as in I used to eat out quite often with my friends and colleagues from orthopedics. And as you probably know, orthopedic surgeons are a very carnivorous bunch. They're now changing, thanks to me, I think, in my immediate group. But I used to say, well, I gave up eating meat and even poultry in 1996, but I carried on with eggs, dairy, and fish for until much later. And I found that every year that I was in the UK, I was putting on about a kilogram in weight. So I got to the dizzy heights of 112 kilograms in my mid 40s. And then I realized that was really not good for me. At the same time, I was traveling quite frequently to India. I had elderly parents who I used to go and look after, and just because of the convenience and because there was a laboratory nearby, I'd go and have some blood tests. And I found that I was progressing from pre-diabetes to definitely diabetic at one point. And so I was trying a variety of things. I tried every single diet that I came across. Name it, I've done it. So keto. And remember that because I wasn't eating meat or fish, my keto options were limited. So, I probably smelt like nothing on earth with all the fish and tuna and stuff that I was eating. And I really wasn't, buying into this plant-based eating way. Although at home I was eating plant-based, but at work and while going out, I would inevitably order something from the meat or, the fish and dairy side. So I tried every diet and I'd yo-yo and my weight would yo-yo, but my diabetes was steadily getting worse. So I realized there was something the matter. Matters came to a head when I literally had a car crash. I was driving Neetu, my wife, to a Christmas dinner with some friends. I had noticed that, I felt it wasn't my vision. I felt the government wasn't spending enough time lighting up the roads like they used to. So I was driving in the dark and I literally nearly went into a lamppost when Neetu was fast asleep next to me because she had a long and tiring day. Woke up suddenly to see I was heading for a lamppost. So I went to this dinner party and there was an ophthalmology surgeon there. And I said to him, I don't know what's happening. I nearly hit a lamppost. So he looked into my eye with an iPhone and said, you've got severe cataract. And that shocked me. So that was, I think that's what it needed for me to reflect on the way I was living my life. So I went along to an optometrist and they said, how did you get here? So I said, well, I drove down. So she did my eye test and said, well, you have to leave your car here, you realize, because you're not legal to drive. So anyway, long story short, I ended up having cataract surgery in both eyes, possibly because I was diabetic. And when I got my vision, it was really quite refreshing to see the colors. I hadn't noticed the world was so colorful. And so I was watching this documentary called Forks Over Knives. And Neetu was at work till late and I was just recuperating from my eye surgery. So I saw this documentary and it somehow resonated hugely with me. So overnight, I said when she came back, I said, I'm going plant-based. And she thought she'd upset me with something or driven me into it. But no, it was a documentary that made me change my ways. So I turned plant-based overnight. And she said to me, I think you better do it a little bit slower than you're planning to do it because you've been eating fish for so long, I think you should eat it once a week or something. But no, I went whole hog and I saw some dramatic benefits. I mean, my diabetic numbers just came down really quite dramatically. I shed over 13 kilograms from my lowest weight that I had got to with my dieting habits. And I've maintained that. But also, it's given me a new vigor for life. I'm much more energetic. I exercise more. I was never a gym bunny, but I've become one, it would seem like. And I've got a lot more energy and enthusiasm. So I then did the lifestyle medicine course and got the diploma because I said, if I'm doing it, I might as well do it properly and learn the right things so that I can impart it to my patients. And that's where I'm at right now. Really much happy. I just wish I'd done it a whole lot earlier. That's all.
Isn't it funny, though, what you're describing there is how the health problems crept up so slowly, you don't notice them. But then when you make the change, you really feel the benefit. And I think it's so lovely when people experience that. And what you've said about sharing that with your patients through the lifestyle medicine, we'd love to hear more about that a bit later on. But first of all, given that you are a bone health doctor, essentially, or you work as an orthopaedic surgeon, so you know lots about the health of the bones, we wondered if you could start by giving us an overview of what we actually mean when we say bone health.
Bone health just means the integrity and the strength in our skeleton. Most people think of bone as being a dead tissue, because when you look at bone, it looks white and it looks pretty dead, but actually it's very, very active. In fact, we turn over our entire skeleton. So we get a new skeleton every 10 years. I mean, that's something that struck me as pretty amazing. And a lot of doctors don't know this either. But really, it's the imbalance between the rate at which we form bone and the rate at which we lose bone that dictates what our bone health would be later on in life when we most need it to be strong. What a lot of people don't know again is the fact that our bone health is kind of maximal, or our bone is strongest between the ages of 25 and 35. And it's a bit like saving up in the financial world. The earlier you start saving, the more you have for retirement. So the more active you are as a youngster in your teenage years is in fact what you have to play with later on. You can afford to lose a bit, but still not go into what we call osteoporosis, which means thinning of the bones, a quantitative reduction in your bones such that you're prone to fractures. So I've just introduced that term osteoporosis, and it's a term that a lot of our patients and your listeners may misunderstand. They think they have pain in their joints because of osteoporosis. I get this quite frequently from patients. What must be remembered is that osteoporosis by itself is not a painful condition unless you actually have a fracture. So sometimes it's quite late that you feel the pain from osteoporosis. And in fact, in some parts of our skeleton, like in the spine, 60% of vertebral crush fractures, and you'll see older people getting a little bit bent over or losing height, they've been asymptomatic. So they've had no symptoms, no pain at all, but yet their skeleton is crumbling. So that is a later stage. And osteoporosis, the way we define it, is based on a DEXA scan, which is a measurement, really. It's an imperfect measurement because it's actually measuring area. So it's a 2D or two-dimensional measurement of what is essentially a density, which is, as you know, mass over volume. So it's actually a 3D thing, but that's a complicated thing to get into. Suffice it to say, it's the best thing we have at present. There's some things that I'm happy to talk about which are better, I think, because it measures bone strength. But osteoporosis just means that you are 2.5 standard deviations below what the normal would be from the age. So if you compare a group of people, a sex and ethnicity matched cohort, they are 2.5 standard deviations below that. So that means essentially that there's more risk of getting a fracture. And what people don't understand is that men are also at a risk. So 1 in 5 men over the age of 60, 65 are at risk of getting a fracture. 1 in 3 women are affected by a fracture as a result of osteoporosis. And that's because men are protected by testosterone that doesn't actually decrease to the same extent as estrogens do in postmenopausal women. So at menopause, women can lose as much as 3% of their overall bone mass. And that's a bit of a concern because that means that you're at a much higher risk of getting a fracture. Osteopenia is another term that is important to understand. And that's if you're -1 to -2.5 below the standard deviation. So you are with your bones again. I would liken it to somebody who is pre-diabetic. In other words, if they continue with that existing lifestyle, they're likely to become diabetic at some point. But both osteopenia and osteoporosis really ought to be treated by lifestyle modifications first, rather than medication. But of course, if medication is prescribed, patients should advocate for themselves and look into it and understand why they're being prescribed medication. Medication has a very limited role, but it does have a role. There's something called a FRAX score, and you can just look it up on a computer and enter all the values in that. And if your risk of getting a long bone fracture is greater than 3%, or any fracture is about 20% if you fall from just a standing height, then you probably ought to be on some protective medication. And most of these drugs actually just stop bone resorption. So they don't increase your bone formation, which is what a better lifestyle would do.
When you say those numbers, when you say in menopause, you can lose up to 3% of your bone density, when you say it like 3% compared to what we hear about muscle, it doesn't sound too bad. So it's incredible how much it can increase your risk of fracture, really. But the key message you're saying is that to actually build up bone, you need to be doing the lifestyle changes, which we're going to go on to a little bit. But the drugs, they're just going to stop the further breakdown of that bone. Is that right?
That's right. But also, I think what a lot of people fail. I mean, you kind of think that it's downhill all the way from the age of 35. But I think what must be remembered is that there are recent studies to suggest that even postmenopausal women who start doing resistance training and changing their lifestyles around can dramatically improve the strength of their bones, even reflected by DEXA scanning. But as I said to you earlier, that's an imperfect test. So basically, the risk of fracture goes down very substantially if they make changes in their lifestyle.
Okay. So lifestyle, it's a very general word, isn't it? So what we want to do is maybe break it down a bit more. And I think, given where we normally go with this podcast, we may as well start with nutrition. And I think, Daisy, you've got lots and lots of questions about nutrition.
I do, yes. Thank you, Claire. Well, I suppose we can't start anywhere other than calcium, because that tends to be what people think about when they think about their bones. That often leads to people thinking about dairy, because I think we've grown up with that notion that we need to eat dairy or drink milk to strengthen the bones. What do you say to that, Rajiv? As plant-based eaters, as vegans, are we missing out by not eating dairy?
No, I would say there are a huge number of plant-based alternatives now to compensate for dairy. And dairy is a broad term, as you know. So there are aspects of dairy like butter, which has a huge amount of myristic acid and all kinds of inflammatory substances. That's absolutely, clearly no good for you. There are other aspects like yogurt and some cheeses in limited quantities that may be beneficial to health. But I would argue that we miss none of those benefits because you get a whole lot of other things that go along with dairy that make it detrimental to our health. We know about heart health and so on, but all the aspects that you get in a plant-based diet are easily met with, easily meet your needs for a healthy skeleton and for your healthy bones. And there's little doubt that the dairy industry and, in fact, the meat industry learned from the experience of cigarette smoking and how to advertise it. So, you have this milk mustache photos and calcium is only there. I mean, milk is really, you can eliminate the middleman or the cow in the process, because calcium is a mineral that's found in soil. So anything that comes from planet Earth really has a lot of calcium in it. And there's a whole lot of things in plant foods that have as much or more. And in fact, milk has a low bioavailability of calcium. So only about 30% of the calcium in milk is absorbed. Whereas certain plant foods, you get a higher absorption of the calcium that's there in it. Especially if you look at green leafy vegetables, tahini, green leafy vegetables barring spinach and Swiss chard, which have a low absorption because they're high in oxalates. But I think we miss none of the aspects. If you're a plant-based eater, you just have to be discerning. I mean, if all you're doing is eating spinach and not consuming some of the glorious other foods that are very rich in calcium, you may be not getting enough calcium. Dairy is talked about as the big thing. I mean, calcium is certainly the Oscar-winning mineral, if you like, but so is magnesium, so is boron. These are all micronutrients that I think plant-based eaters get more easily by consuming seeds and nuts and things. I mean, boron, for instance, stabilizes your vitamin D. Magnesium, as you know, is also essential for the skeleton. And in fact, omnivores probably are more deficient in magnesium than plant-based eaters. So I think while milk is touted or dairy is touted as a great food, we miss nothing by becoming discerning plant-based eaters. You just have to plan your diet really well and not just eat one aspect, like eating spinach, which has a lot of oxalates in it.
Absolutely, yeah. And you mentioned the dark leafy vegetables as a good source. I think for people that are new to plant-based eating, perhaps are not sure where to get their calcium from, can you share a few of your favourites or a few more examples of plant-based calcium?
I was just thinking of what I just had for breakfast, which was pinhead oats cooked in soy milk. And I prefer the unsweetened soy milk because, well, first of all, it has a whole lot of protein in it. Your oats will give you 200 milligrams of calcium in itself, plus your milk, and I add a whole lot of berries to it, some nuts. That itself gives me upwards of 200-300 milligrams of calcium. The recommended daily allowance in the UK is 700, but I try and shoot for a little bit higher, and I find I easily achieve that. I know there was the Oxford study that I'm sure we'll get into at some point, where it was found that plant-based eaters were getting less than that of calcium. But those were different times. And now, I make sure that I incorporate at least half a block of tofu into my diet almost every day. And that in itself meets my calcium requirements by itself. And that's calcium set tofu. So I prefer that actually. There's several brands available, but the calcium set tofu has calcium sulfate in it and is a very good form of tofu. I find it tastier than the Nigari set tofu, which has magnesium chloride, I think, as the setting agent, if you like. I think hummus, which every plant-based eater should be well aware of, and it should probably be a food group on its own for plant-based eaters, has a lot of tahini in it. And tahini is a very rich source of calcium, as are the green leafy vegetables that you talked about. So broccoli, pak choi, kale, all these wonderful things have a higher bioavailability of calcium than, let's say, spinach and Swiss chard. So I'm not eliminating Swiss chard and spinach certainly from my diet, but I'm not going to use that as a calcium source because only about 5 to 10% of calcium from that is absorbed.
Brilliant. Thank you. Those are really great examples. And we love tofu. We often talk about tofu on this podcast. But I tell you, a funny one that I didn't realise was how much calcium there is in an orange. Really high amounts.
That shocked me, actually. I have to say, we were discussing this last night because, as you know, I have a nutritionist in my family. So I run a few things by her. But 50 milligrams in a standard size orange, I suppose a smaller satsuma that we commonly get would probably be half of that. But that again, just tells you how easily anything that grows from the soil if you eat plenty of produce, you're going to get enough calcium in your diet.
Yeah, that's brilliant. And you did mention that you drink soya milk. I know that some people use plant-based milks as a like-for-like swap in terms of getting calcium. And most of these plant-based milks are fortified with calcium. But is there any difference in the absorption from the calcium that we get from plant-based milks compared to dairy milk? Do we know anything of that?
I think there's studies to suggest that they're about equal. Now, some plant-based milks will have phytates because they have soy milk in them. Soya is a bean and has phytates. It's about equal to a 2% dairy milk, I've seen. And the fortifications, which actually are a common method of making sure that we get those vital nutrients, don't alter the taste so much at all of it. So calcium carbonate is added to soy milk, or citrate malate, which in fact doesn't alter the taste at all and gives you a plentiful source of calcium. So I would say it's about the same as dairy milk, which a third is absorbed. And I think if you cook certain things, your phytates and oxalates decrease to a degree. So in fact, the bioavailability is better sometimes than dairy milk.
Okay, that's really useful to know. But what would you say to people who are still cautious about plant-based milks or don't like the fact they have added oils or sugars or emulsifiers in them, for example? They're deemed as processed foods or ultra-processed foods.
What I would say an ultra-processed food is when you remove a lot of the good nutrients and add a whole lot of stuff that isn't good for health into them. And I would say soy milk, for instance, is certainly a processed food, yes, but it's a green light food, so it's actually good for health. It still has some fiber, it has added calcium to it, and it has quite a lot of protein, so you can get 3.3 grams of protein from most soy milk. So as you can see, I'm kind of favoring soy milk as the plant milk of choice. People do love their oat milk. A lot of my family members will have it in their coffee. I personally think coffee should be had black and without anything added to it. But I certainly think compared to almond milk or oat milk, the footprint on the environment is also lower for soy milk, as well as it's far more nutritively beneficial. Plus, there are a whole lot of added things to it, like vitamin B, B1, B2, as well as vitamin D is added to soy milk as a public health measure to get fortifications which are useful for health.
Brilliant, thank you. I'm going to ask you about vitamin D, but I just wanted to say you must be drinking very good quality coffee if you're drinking it black. But yes, vitamin D, that's quite an important vitamin, isn't it, for the absorption of calcium? Can you tell us a bit more about that and how to obtain that?
Yes, I think vitamin D is actually a misnomer because it behaves more like a hormone, and it's something that we shouldn't normally have to take because it's from exposure to sunlight, particularly UVB rays, and it's an evolutionary hormone because when we were hunter-gatherers, well, I would say gatherer-hunters because we were poor hunters, we were more gatherers, we'd get exposure to UVB light and make our own vitamin D in our skin from cholesterol that's present in our skin. We now, particularly living in latitudes below or above 40 degrees, we don't get enough sunlight through the year. And especially if you have pigmented skin, like Asian people or who are darker skinned, you just don't make enough vitamin D. And so supplementing it is a really good idea. It's important to understand that vitamin D has a whole lot of roles other than just maintaining the integrity of the skeleton. It actually helps absorption of calcium in the gut. So vitamin D helps in bringing calcium into the bloodstream, and vitamin K, which I'm sure we'll talk about later, helps retain it in the skeleton. Other than that, it has another big role in the musculoskeletal system because it's important for type 2 muscle fibers. And those are the so-called fast twitch muscle fibers that help us react to a situation. So let's say I tripped over a carpet. It's my fast twitch fibers in my gastrocnemius that will help to get my balance back. And if we lose those fibers as we age, unless you train them specifically. So I'm sure when we get into exercise and strength training, we'll talk about that in greater detail. But those are two important roles for vitamin D besides having effects in the brain, so it prevents dementia. It actually helps even diabetes. And I was shocked when I had my my vitamin D levels done for the first time, because when it kind of gained importance and we understood how important it was, I had it measured and I was at a ridiculously low level. And I found that I think Asians in general don't absorb vitamin D very easily. Even if you're taking 400 units, which is what is there in the favored plant-based tablet or Veg 1 supplement that we all seem to like, it has 400 international units, but I take up to 4,000. And with that, my levels have gone up to 79. It's recommended that you don't take more than 4,000. But I think it's important to understand in vitamin D metabolism that the receptors that are there in our gastrointestinal tract that help you absorb vitamin D are actually induced by vitamin D itself. So, in other words, a high dose of vitamin D is perhaps necessary to get those receptors to start absorbing vitamin D. So those who are struggling to bring up their levels, and I always recommend to my patients, especially patients who've had a low level, to get it measured every year and make sure that they are in the normal range. It's actually very difficult to get too much vitamin D. I'm not advocating that you consume more than 4,000 international units, but hypervitaminosis D, which is a recognized condition, is actually extremely rare. It's one of those vitamins, although it's fat soluble, it's difficult to get too much of it.
Yeah, I agree. And I quite often advise my patients to take over the counter, usually 1,000 units, but as you say, up to 4,000 international units a day, particularly over the winter months. But there are concerns, though, aren't there, with calcium supplements? Because I have some patients who will go out and buy vitamin D combined with calcium because they're worried about their bone health, or they think they're not getting enough calcium in the plant-based diet. I've sort of perhaps stopped prescribing. We used to prescribe it a lot for osteopenia, Claire. Do you remember? I've sort of stopped prescribing it. That's right.
MCh was a favored one. And I think, if in the Indian subcontinent, I have rarely met anybody above the age of 50 who isn't on some kind of calcium vitamin D combination. And what frightened me was reading about it in greater detail. I mean, there was a paper by Bolin and Reed from Auckland back in 2011. So it's not a new paper. It's not a recent paper. It was further confirmed by EPIC Heidelberg, so one of the EPIC studies. And I think the reason calcium was first introduced into the diet was, in fact, as a method of reducing the amount of saturated fats that we absorbed into our body. So it was thought of as a good technique to lower cholesterol and actually treat hypertensive patients, not just osteoporosis. But this study, and it was quite a large cohort study, said that there was a direct correlation between elemental calcium, or in other words, calcium supplements that one took, and the risk of getting atherosclerosis and even having myocardial infarction. So, I mean, that suitably scared me. And I think what our listeners should really understand is that calcium is regulated in a very narrow interval. So, if you need more calcium because the body has dumped calcium somewhere else, then we just get it from our reservoir. And 99% of our calcium is in our bones and teeth. So you just take out more from your skeleton. You borrow it from there and absorb a bit more when you next consume calcium in some form. So we shouldn't really be supplementing it as elemental calcium. Fortification is absolutely fine. It just means you're bringing to a certain level which doesn't interfere with taste and is in fact a recognized public health measure. But elemental calcium by itself, I would be dead against.
I can't remember where I was reading. It was something to do with the spikes that it causes in your blood
Absolutely
calcium
right.
levels. Is that right?
Mm-hmm.
Interesting. Okay, and in terms of calcium, I guess we've established it's better to get it through our diets. We can get as much as we need through a well-planned plant-based diet. But what about this term I've often heard bouncing around called calcium thieves? What are the sorts of things that can affect our absorption of this important calcium?
Yeah, that's a great question, Daisy, because as I said to you, osteoporosis is a balance between bone formation and bone loss. Similarly, we talk about calcium intake, but we sometimes neglect the fact that certain things that we do in our lifestyle can harm us because it leaches calcium away from bones. So, caffeine is the first one I'll tackle. I mean, I've talked about the benefits of caffeine, and there are many, of coffee rather, of good quality coffee. And coffee, by the way, my daughter insists I must buy the best quality because it's one of those where pesticides are quite heavily concentrated. So I buy, organic ones that are really very good and very palatable, even in the black form, as I said, just by itself. But having more than 4 cups of coffee or 5 cups of coffee, especially in postmenopausal women, and they've studied 800 milligrams of caffeine per day, can prevent calcium absorption and therefore allow calcium to disappear from the system. So that's one thing. Smoking is well known to be another issue. And alcohol, I mean, no amount of alcohol is good for health. Some people have suggested, a small to moderate consumption of red wine may be good for bones. But I don't think there's too much literature, and certainly the harms outweigh the benefits of alcohol. These are the main ones that I can think of. But of course, the biggest culprit is sugar-sweetened beverages. Sugar-sweetened beverages have 3 bad things in them. So they have a huge amount of salt. And a gram of salt extra per day reduces your skeleton quantity by 1% in a year. And that's because salt competes with calcium in the proximal tubule of the kidney for reabsorption. So salt is one thing. Sugar in any form, but more than 5 to 6 grams of sugar per day. And sugar-sweetened beverages, as I said, is like a triple whammy because you have too much salt in it, too much sugar, and phosphoric acid, which changes the pH. And as a way to neutralize this, we mobilize calcium from our skeleton and lose it. It's hardly a wonder, therefore, that Americans are told to consume between 1,000 and I think it's 1,200 milligrams of calcium a day because their diet is so rich in sodas, as they call it, or sugar-sweetened beverages, particularly cola, because that also has caffeine in it. So cola drinks I would really counsel against. I mean, people talk about it as being relatively harmless, especially a diet cola. But I would say that if it has these elements in it, phosphoric acid, salt, sugar, then it's particularly harmful. And it's a great example of a calcium thief.
I don't drink sugar-sweetened beverages, but I do like salty foods. I've got to work on that one, reducing my salt intake.
Me too. I think it's very, very easy to get through a bag of cashew nuts or peanuts for me, and
Yeah.
I have to work on that too. Yeah,
Exactly.
Do you add it to your white rice when you're cooking, Daisy?
What, salt?
Yeah.
Of course.
Talking about this, really it's the processed foods or ultra-processed foods that come as a big source of salt, isn't it? I mean, even your bread, if you buy it, you have to really read the nutrition. I mean, because my daughter's a nutritionist, I turn it over and read the nutrition label first before I buy a form of bread. And then I run it through her eagle eye to make sure that I've got that one right. Because there are some great breads, sourdough breads, for instance, which are available with a very high protein content, which I look for. And some of them have a high salt content also, so you should just be aware of it.
Interesting. Yeah, read the labels. 100% agree. Reggie, before we move on from nutrition, can you tell us a little bit about the other micronutrients? You sort of hinted at the importance of things like magnesium or phosphorus. I don't think they're talked about as much. Can you give us an idea of those sorts of nutrients?
Yes, we talked about calcium being required to the extent of 700 milligrams a day. But I think it's more the importance of the ratio between calcium and phosphorus that we get. So 550 milligrams of phosphorus is what is recommended in your diet per day. And these are available, in our standard whole food plant-based diet. So you get it in fruits, you get it in nuts and seeds and whole grains as well. Very easy to get those. Boron, again, very small quantity required. So none of these are nutrients of huge concern if you're eating a well-balanced diet that has a variety of all the things that we talk about incessantly, namely whole grains, fruits, vegetables, nuts and seeds. And if you get these and you get all these in small quantities. Silicon is another one. And silicon, again, is present in a lot of plant-based foods. It's also present in beer, but I never recommend that should be your source of silicon. All these are important micronutrients that are important. Besides this, I don't think we touched upon vitamin K, and vitamin K1 is present in a lot of green leafy vegetables. Actually, converted to vitamin K2 in the colon. And for plant-based eaters, we get our vitamin K2 from sources that are not so common in the plant-based diet. And as such, there's not too much evidence, hard evidence, that K2 is really important. It's probably important in certain ways. And for instance, you get it in prunes, and prunes is a great source also of phenolics or polyphenols that are great. Plus, they have a lot of fiber, and because they're smaller in size and they're dried plums essentially, it's recommended. And there was a study in 2021 to suggest that postmenopausal women would benefit from consuming 4 to 6 prunes a day. Plus, obviously, because they have a high fiber content, they help with bowel motion, with a lot of older people really struggle with on a day-to-day basis. But K2 is also found in fermented foods, such as natto, which is, you may take it or leave it, soybean thing. I had a lot of it, luckily visited Japan recently, and I quite enjoyed having natto, but it's a taste that has to be acquired, I think. And you get it in sauerkraut and kimchi as well. And K2 seems to also prevent the side effect that the calcium goes to your atherosclerotic plaque, because it helps to prevent this heterotopic ossification or calcification of areas. So it helps to bind it within bone by, in some way, inducing osteocalcin. And that, again, is something that prunes helps us do.
Wow, I never knew that. And prunes are delicious. That's really, I'm going to buy some of those. We probably need to move on to exercise soon, but I just wanted to touch on, I know protein is a big topic, and we actually are going to dedicate a whole episode soon, but is there anything in particular you want to mention about protein in bone health before we move on?
Yes, I think just to say that protein is actually the only essential macronutrient. And I think as plant-based eaters, sometimes we not talk about the necessity of protein quite so much, because protein, somehow people seem to think it only comes from eating meat or animal products. And I would argue that you get as much protein, as high quality protein. And the first thing to remember is that all 9 amino acids that are essential to our health, which we don't make ourselves, are present in every plant food. Yes, certain foods like soybean and quinoa have it in the same ratio as is present in egg white, which is for some reason considered the gold standard, if you like. But by a combination of foods, you have a pool of amino acids in our body that is adequate. If I had to shout out to one particular protein source, I would certainly say soybean is up there. And it's the most studied bean. There are over 4,000 studies. It's been present since, it was found in China 4,000 years ago. It's been consumed widely. It hasn't got a very good press sometimes, but a big shout out to soybean, because not only does it have a very high quality protein, but it has a high quantity of protein. And even slightly processed foods like we talked about earlier, tofu and tempeh, are fantastic sources of protein. You can get as much as 52 grams from a block of tofu. And my family churns through about 2 or 3 of these every day. So that and tempeh are great sources. They also allow you to absorb your calcium. They also have these phytonutrients, so they have these phytoestrogens in particular that are beneficial phytoestrogens. They're called SERMs, actually, selective estrogen receptor modulators. So they actually have a better effect on bone. So they help you form bone to a third of the potential of estrogens. So daidzein and genistein, these are two phytoestrogens present in soya, and they help you form bone. But the effect on the breast receptors, the alpha receptors, is only about 1,000. So actually, they block the effect of estrogens on the breast. So soya is a big protein source that I would like to highlight. But if you're training or if you're trying to put on muscle or strengthen your bones, and especially if you're older, let's say over the age of 60 or so, you probably should be shooting for 1.6 to 1.8. 1.6 is more than enough, I would say, if you're training grams of protein per kilogram of your body weight. And that's quite easy to achieve because, as I just said to you, a block of tofu, 52 grams, your oats in the morning. And I tend to front load my own diet. I found that as I've gotten older, my appetite has reduced. I mean, I could eat like a monster when I was younger, but I really struggle some days to try and pack in 3 meals. So I front load my protein intake. And we know that plant protein, I mean, the Nurses' Health Study tells us that plant protein reduces your frailty by 14%. That was really quite phenomenal. Whereas animal protein increases your frailty by 7%. So these are figures to remember. So I put a protein powder into my porridge in the mornings. I make sure that I get about 60 to 70 grams in the morning. So I don't have to worry even if I'm at work and I get an avocado or bean sandwich on the run. That gives me another 10, 15 grams, and I get the rest of my proteins at night. So I think protein is important, and it's important to understand that all plants have protein. You sometimes have to eat much more if you're just getting it from simple vegetables. So you have to plan it a little bit better and make sure that you get rich protein sources such as tofu or tempeh, or lentils. Lentils is another great source of proteins with a much lower carbohydrate component. I hope that covers protein, but no plant-based eater should worry about it. Plant-based health professionals have a set of very useful fact sheets on our website, and you can get enough protein if you just think about it a little more.
I agree. We'll put the links up for the calcium and the protein fact sheets on this episode. I hope we've covered nutrition in enough detail, but we certainly need to cover exercise, if you don't mind. Claire, you had some questions about exercise, didn't you?
Yeah, questions about exercise, definitely, as what seems to be the next most important lifestyle pillar. Maybe thinking a bit about how you yourself, when you're talking to patients, maybe, how are you incorporating that advice there? What are you telling them is important about exercise and bones?
The first thing I say is that it should be both forms of exercise, so aerobic as well as resistance training or lifting weights in some form. It doesn't have to be, going to a gym and working on machines, or you can just buy a simple set of dumbbells and start doing some exercises. A lot of my patients, I get them because I deal with a lot of back pain. I get people who are in sedentary occupations. So I have to start them off fairly basic and encourage them to do what the International Board of Lifestyle Medicine would suggest, namely getting about 150 minutes of aerobic exercise every week, which is not a lot really if you look at it. It's 20 to 30 minutes of walking briskly every day. That would get you your aerobic exercise. If you want to do more than that, anything more incrementally is great. But I also want them to incorporate some amount of resistance training. And if they're novices in that area, and if they're elderly, or in fact, if they have osteoporosis that has been diagnosed, well, first of all, I think osteoporosis sometimes is handled so badly because a lot of our doctors want to wrap them up in bubble wrap and prevent them from getting any injury, whereas in fact they should be telling them exactly the opposite. They should tell them perhaps if they can afford it, to get a personal trainer, but otherwise to do gradually incremental amounts of resistance training. And by that I mean you lift a certain weight and do a certain number of repetitions or sets on one particular day. You try and increase it as you get stronger. And that is the essential thing that I impart to all my patients. So getting at least 60 minutes of resistance training of some form. And by that, I don't necessarily, as I said, mean lifting very heavy weights. The heavier you lift, the stronger you become. But yes, there are some risks as you get older that you could cause yourself injury. So if you can do it in a supervised setting or with a buddy, in fact, that encourages you to do more and more. Somebody should prevent you from getting an injury when you're doing that. That is a useful method of training. So training with a buddy is a good thing. And really doing a variety of exercises. So not just doing one or two things, but even simple activities. Is using a mini trampoline is a very popular thing in America. We don't have it so much in the UK, but trampolining, skipping is a simple thing, or doing jumping jacks, because these are methods where you're imparting a sudden shock to bone and you're actually causing microfractures. But as long as they don't progress to a macrofracture, you're actually strengthening your bone by any of these gravity resisted or methods, So these are methods that you use to impart a greater stress on bone, because ultimately bone becomes stronger if you put it under stress. So walking, even running, they're good exercises, but to give it a greater benefit, maybe use wrist straps, with weights, or wear a weighted jacket if you're walking or running. And that gives it that additional weight or load that makes your bone stronger.
Just while we're on that, it was a couple of years ago now, but we had a bit of a shake-up in the plant-based community where there was a study that came out using the EPIC Oxford cohort that had this link between being vegan and increased fracture risk. Should we be worried about that?
I mean, that was a good study, I would say, as far as cohort studies go. But it studied a population where data was collected in the late 90s and up until, I think it was 2011 from memory. It studied a group of vegans in the UK who were just not getting enough calcium in their diet. They didn't actually correct for vitamin D levels, and a lot of these people were not supplementing their vitamin D, all of which we in the plant-based health professional group certainly would recommend people supplement their diet with B12, vitamin D, and get enough protein. Those people were getting less protein as well. They were getting enough fiber in their diet, it would appear, by most standards. But they weren't eating as healthy a diet as I believe a lot of aware plant-based eaters are eating these days. In any case, the actual risk, if you see, of the fractures that they got was 15 out of 1,000 over a 10-year period. So it's actually quite a small number. And I think if they were healthy in all other regards, they probably would live through their fractures. As we know, one of the biggest risks of osteoporosis is there are a third of patients who have a fracture of the hip tend to die in the first year, up to a third, which is a very high mortality rate. In fact, it's the highest risk in that group above 60 of accidental death if you get a fracture of your hip. So we obviously need to prevent that. But the other important conclusion from that study was that the ideal BMI was around the 22, 23 mark. So in other words, being too underweight was also a big concern. And by that, I mean that the lean muscle and bone weight should be higher. So in other words, I don't want people to be obese vegans or obese plant-based eaters, but they should have a healthy body weight centering around the 23 BMI level, most of which is muscle and bone. And I think as people get more conscious about how much exercise they need to do and what ways they eat, it doesn't really cause a huge amount, shouldn't cause much concern amongst vegans.
Oh, that's good to hear. I mean, just thinking maybe a little bit more about how you're working at the moment. If you've got somebody who's coming up for an operation and they've got to have some surgery on their spine, what do you tell them about lifestyle factors that they can maybe take in terms of before they have the operation and how to aid their recovery? What things come into that?
I think that's a great question, Claire. And I think as you are a runner, I believe, and all of us do a fair amount of exercise in our group. We know that we tend to recover much more quickly on a plant-based diet, and it's because of the kind of things we eat. So I would counsel usually all my patients. Some are overweight, some are, have other lifestyle issues like they're smokers. And my anesthetist certainly wants me to tell them that even if they stopped smoking for 24 hours before their operation, that would make a huge difference to their recovery. So smoking is one aspect, but I tell them to eat a mostly plant-based diet if they can, with a large amount of greens every day. And they may not be eating that way at all, but I say it'll help aid their recovery. So if they eat more in the way of nuts and seeds, where they get their zinc, they eat more fruit. Let's say we talked about oranges or satsumas as being a great source of vitamin C. Zinc is another important factor. I don't think people have studied this in great detail, but just from an anecdotal experience, I think my patients recover much more quickly if they do make these small adjustments to their preoperative plan while they're waiting for surgery for a week or two. Even that is good enough, really, to make a big difference in how quickly they recover.
You mentioned, there maybe not being such great evidence for something like red wine as a health benefit, and I think I know where we're going on alcohol. But any specific comments about alcohol and bone health? Do you ask patients about how much alcohol they drink?
I do. I always do, because I think there's really no health benefit, no single health benefit of alcohol, whichever way. A lot of people have talked about resveratrol and this and that, but I mean, you might as well eat a handful of red grapes if you want your resveratrol. So there's no real benefit in alcohol. And if they are consuming alcohol for social reasons or whatever reasons, if they can cut down the amount they drink during their recovery, they pre-operatively as well as post-operatively, I think it'll aid in their recovery from surgery.
One of the things that people find really hard to fix, I find when I'm talking to patients about lifestyle, and it's because it seems to flow from a lot of other factors in their life, is sleep and, anxiety levels, stress levels. Is there any evidence at all about how much sleep we get might affect, this is quite specific really, but how much sleep we get might affect bone health or your risk of developing something like osteoporosis?
Thank you, Claire. That's important, I think. And as I talked to you about my own journey where I was very overweight, I mean, there's little doubt that stress played a huge factor also in my life. It's not just the poor diet. I mean, I used to eat a sandwich, a bag of crisps, and a sugar-sweetened beverage for lunch sometimes at work. But stress plays a huge role in our lives. And as a spinal surgeon, I often used to worry about an operation that I had either done and I found that it would affect my sleep. And lack of sleep increases your cortisol levels, that is so detrimental to your bone health. And so in part of the history taking for a patient with osteoporosis, I would ask them, for instance, if they're on steroids for asthma or some other immunological condition. But what we don't often ask about is whether they're under stress. And I think that should be an important part. So it's easy to tell somebody, don't be stressed about this, but actually to take measures such as to resort to meditation on a daily basis or some form of stress relaxation, not inclusive of alcohol, is actually so much of benefit in terms of the cortisol levels that it reduces and the impact on one's skeleton.
Mm. it would be great if we could make sleep improve and stress disappear, I think, so often in terms of all conditions. But
Absolutely.
we're still struggling a lot with that, I think, as clinicians. One group that I think we've maybe not talked about yet, certainly in this discussion, and it's so I just wanted to ask you if you had any thoughts on it. We've talked a lot about adult bone health, and we've talked a lot about what happens as we get older, but what about children? If somebody is bringing up their children as plant-based and they've heard about, terrible diseases like rickets that happen in children, are there any specific considerations that we can sort of comment on here just to reassure them about the healthfulness of the plant-based diet?
I'm not familiar with too many pediatric conditions, but all I'd say is in general, children certainly need more fats in their diet. And so therefore, unless they're allergic to something, so I say peanut butter, for instance, is a great source of protein as well as the essential fats that are necessary. Also, I think vitamin D supplementation in children should be looked at also in a plant-based diet. But really, there's absolutely no reason why a child cannot be brought up healthy on a plant-based diet. And so many of our favorite dietitians and clinicians in the world are bringing up their own children and grandchildren. I mean, Brenda Davis talks about this extensively. And really, there's so many experts who say that it's healthier to bring up a child on a plant-based diet, but we shouldn't perhaps be restricting them from certain high-caloric foods that we as adults sometimes tend to avoid. So nuts and seeds are great sources of a lot of these micronutrients as well as protein sources and fats for children to grow up on. And rickets, for instance, which is a deficiency of vitamin D, is so rarely seen now, even on a plant-based diet. So it means that they are getting all the nutrients that they require.
Thanks for clarifying what rickets is caused by, because for a moment I had a blank and I thought we haven't actually clarified that.
Claire, is it worth signposting listeners to our episode with Paula Hallam? It feels like such a long time ago, Rajiv, but we had a plant-based paediatric dietitian on and I just looked it up. So listeners, if you do have children or grandchildren, go back to January 2024, where we had a really great discussion about bringing up plant-based children with our dietitian, Paula Hallam.
Right, yeah. And I think, Rajiv, if you've got any other resources that you want to share with listeners, I know we'll include the ones from plant-based health professionals. We'll make sure that we've got a good stack of evidence in the show notes for people to go to if they want to explore some of the topics in this episode. We are, I think, if we're all happy with that, we're at the point where we want to talk about what we're having for dinner tonight.
Perfect. Well, I'm the chef in the house, it would appear, these days. I sadly took to it over COVID because of lack of anything better to do. And so my family relies on me quite often to feed them. So tonight, I love these single pot recipes. They're firstly easy to make, but I also make sure I get all the nutrition into a single pot. So I have an Instapot. So I'm going to cook a lentil rice tonight. So I use brown rice and I use a mixture of lentils, green lentils, brown lentils, even some chickpeas into that. And then I use, a vegetable stock. I use a few spices. And I also believe in being in adding a whole lot of extra good things as long as it doesn't alter the taste so much. So I put spinach and coriander, a few herbs into it, as well as spices. And I have added tempeh to tonight's mixture. So that's my Instant Pot rice. But as I said to you, I consume an industrial quantity of my family consumes an industrial quantity of tofu during the week. So I'm making a gochujang tofu. And I find that, you can make it very simply, but if you marinate it with a little bit of soy sauce in advance and air fry it, it makes it a little bit crispy. And I know about the AGEs and things, so I don't put much oil into it, but it's just the texture is altered a little bit. And as you know, tofu can be made delicious by just a little bit of attention to how you marinate it. And then I make a gochujang sauce, which is a Korean sauce that is spicy and delicious. And I put a bit of, put some sesame seeds on top. So that is a source of calcium in that in addition. And I put some chopped green onions, actually. I chop them into little bits and make it look really quite attractive. So that's what my family are eating with a side salad. So we add a whole bunch of vegetables and put a little bit of balsamic vinegar on that. And we somehow, ours is a bowl family. So we eat in a large bowl, like a Buddha bowl, and really put a number of things into it.
Your dinner sounds delicious, Rajiv. I was going to ask whether I can be adopted into your family.
For the bowl.
Yeah, the bowl family. What about you, Claire? What are you having for dinner tonight?
Oh, I think I'm having something that a lot of people have talked about before. If I'm feeling a bit more adventurous, I might do some kimchi pancakes as a starter, because I know you wanted an update on that, Daisy, and the kimchi is finished. And so I do some little pancakes where I throw those into kind of the chickpea flour and a bit of normal flour mix. And I've got this homemade kimchi, Rajiv, that
Wonderful.
I made a couple of weeks ago, having done a course. So I've always got jars of that bubbling away, or hopefully not bubbling away, because you're supposed to kind of chill it down.
Cover
and then
it,
it's not
yeah.
supposed to do anything else, explode or anything. And then as the main, I'm just going to do a really simple, I've got a pot of green Thai, plant-based curry sauce, and I just mix that up with a bit of coconut milk and add all the kind of, red pepper veggies. I'm probably going to do some crispy tofu as well.
Good
Put
idea,
that on the top and serve that with some brown rice. Or, actually, I have got, and I wanted to mention this because I know you love it, Rajiv, because you told me about it in the past, the noodles that are made from yellow peas.
It's Zenbi kind of
Yes,
pasta.
yes.
Yeah.
I've got the noodles, and so whenever I make like a Thai curry or something like that, I usually chuck those in, and then I know that I'm getting that protein boost that you talked about.
Also, those noodles are difficult to overcook. They're kind of chewy and
Yeah,
maintain their texture and shape really quite well. So I'm very fond of that. Yes.
yeah. So Daisy's always got a good Friday night dinner. So what are you having, Daisy?
Well, I don't have a good Friday night dinner tonight because I really want to tell you about my lunch yesterday. I'm going.
That's fine.
Going off script. Well, because you mentioned chickpea flour, it just reminded me I haven't hardly ever used chickpea flour before, but I have this new book from the Viva. Oh, I think your dogs are hungry for my chickpea flour omelette. I can hear them in the background. No, Claire recommended a book called, what's it called, Claire?
It's called Anyone Can Cook Vegan, and I've bought about 4 copies of it so far and given them away to various people.
It's brilliant. It's from the Viva charity, and in there's a chickpea flour omelette. And it's so simple. You add chickpea flour, a little bit of black salt, so kala namak to make it eggy, some turmeric, salt and pepper, and that's your batter. And to that omelette, you can then add whatever veggies you've got. So I had mushrooms, tomatoes, and you sort of just saute all of those into your omelette. And it was great. It was, chickpea flour is something quite new to me, but I'm
That's
enjoying it.
a very popular North Indian dish. It's called a chilla, actually.
Is that right?
They have it as a breakfast pancake, in actual fact. I mean, as you know, in
Very
some
nice.
parts of the world, they really prefer savory breakfast. And India, actually, very few people have a sweetish or, a porridge type breakfast. But we've converted to the porridge over here just because it's a great base for adding all your berries and your protein powder and so on, and getting all your good things in one bowl,
How lovely, yeah. And that can easily be a dinner just with the side salad, maybe some flatbreads or something. It was great, yeah. So,
fantastic.
anyway, so we come to an end, and we just want to say thank you so much for your time, Rajiv. It was really fun chatting with you today and getting all these plant-based ideas for calcium and bone health. So thank you for that.
No, thank you for having me. And really enjoyed that conversation. It seemed to flow quite organically.
Yeah, wonderful. Thank you again.
Thank you.